Volaris, Anne McCreath, HSSES, Services Delivery Manager, Operations EMEA at Wood PLC, and Mario Leokizzi, who's Director of HR at Shelf Drilling, will be on the panel to discuss mental health awareness. I just want to say, on behalf of all of us here on the committee, and I'm sure yourselves as well as SAPC members, we really appreciate the panelists coming here and making the effort to travel to be on the panel today. And so I just wanted to say thank you again. Thank you.
Thank you, Gareth. Maybe before we just get started, maybe I'll ask the panelists just to give themselves a short introduction and a short bio of themselves, if that's okay, so we could get to know a bit about their background. Yeah.
Good afternoon, everyone. So my name is Anne McCreath. As you can see, I'm the HSSAS Service Delivery Manager. By way of background, a bit different. I come from a mental health nursing background, and also cognitive, behavioural and psychotherapy, so CBT. Thank you.
Good afternoon, everyone. I'm Tina Welsh. I work for Volaris. I'm the Director for Internal Communications and Organisational Health. I have 30 years of background in human resources, latterly moved into the role in internal communications and organisational health, predominantly looking after employee engagement and making sure that we're looking after the mental health and well-being of our employees.
Good afternoon, Darren Sutherland. I'm currently the VP for Europe, Africa at Bore Drilling. 30 years in industry, based out of Aberdeen, and last year I handed over the role as chairman of the North Sea IADC chapter, and I've been in charge of the mental health task force that we've set up within IADC to address mental health in the energy sector.
Good afternoon all, my name is Mario Leokizzi. I'm currently the Director HR for Shelf Drilling. My background is operation. I started my career back in 2006 in Transocean, and I was in various roles, offshore and onshore, as rig manager, operation manager. And then a couple of years ago, I joined here in Dubai as a Director HSE, and then now to HR. So I moved my career from operation to other department.
We've just met, but it has to.
Thank you, everyone. I think a little bit more dynamic than myself reading out some scripted bio, so thank you. Maybe it just picked up on Dr. Nuss's slide there that 1/3 of the offshore workforce, or the surveyed workforce, was defined as being clinically depressed or suffering from clinical depression. And then there really was a statistic that grabbed my attention in the slides. And I thought maybe we could start off today by asking Darren and Tina and Anne to share some of the best practice that's been developed in the North Sea. And I know that the three of you have been championing the mental health charter that was developed within the North Sea chapter. And maybe you could give us some idea of what that was about and why that was started.
Yeah, no problem, Doug. So the task. Yes, the task force and the charter originated on the back of a speech I gave as chairman at Safety Awards dinner, a bit like this. Prior to the awards dinner, a colleague and a close family friend both had young boys, 21-year-old, who both committed suicide in the same year. And whilst it's sad for the individual passing, it was the destruction, the path of destruction that left with family members, friends, colleagues, all asking questions about why, what didn't I see, how could this happen? So when I got up in my speech, I talked about how great we were doing the S and the E in HSE. We do all the best equipment, the best PPE, we've got policies, procedures. We're very good at that, but how good are we at the H part of HSE? Of course, we do medicals, provide medical cover offshore, but how good are we at looking after the well-being? So I challenge the audience, I challenge the business leaders there to ask themselves, are we doing enough? And when I come off the stage, quite a few of those guys come up and say, great, well done, you're hitting all the pertinent points. And then one of Tina's tool pushers, who was there for an award, came striding up and he said, that was absolutely fantastic. What are you going to do about it? And that really, a bit of a punch in the face actually, because as the head of the industry body, you can't get up there and say, this is a problem, and then not actively work towards a solution. So I went away, got in a chat from a PR agency that I knew. We said, let's do some posters. He said, yeah, posters have been done, but it's not working. Let's do some videos. Yeah, videos are being done, but they're not working. And what fell out of that was we need to have a look at how do we change the culture, because it's not just about raising awareness, it's about changing culture and how people view mental health, particularly in a very male-dominated industry where, you know, in the North Sea, we're very proud. We say we're North Sea tigers, and we're not one for showing emotion. So from that, we used some of the stuff out of Dr. Noosa's reports. We produced our own white paper on the subject, and it raised a lot of red flags for people in the industry. And we held a panel session, a bit like this, 200 people, and a workshop. And out of that workshop, and the feedback we got from the workshop, we developed the mental health charter. We call it the IADC mental health charter, but there was people from across the sector in that meeting. And the point is, it's a charter developed by industry, for industry. This is what you've told us we should be doing. So we've rolled that out, and then on the back of that, we've created a mental health task force, and Tina and Anne sit on that, along with several other highly qualified individuals. And the next phase of this is we're going to do our very own specific study on the North Sea, because you put those numbers up there, and unfortunately, a lot of people go, nah, that's not me, that's not my rig, that's not my company. So we're going to have a deep dive specifically in the North Sea, and we'll use that to then drive what initiatives we carry out in the North Sea sector. So that's how it came about, Doug. And what we'd like to say though is thank you for inviting us, because all the IADC chapters have been looking in, going, we'll wait and see. And you're the first chapter that said, come and tell us about it. So but we really appreciate you having us down here.
Thank you. And then maybe just a follow up to we saw the slide from Dr. Noosa, which talked about the overlap between mental health and well-being, and we've seen historically that term being interchangeable. And as a clinician, would you be able to give us some guidance on, do they overlap as the slide was showing, or should we be talking about these as two separate issues?
So the words mental health and well-being. So yes, interesting question, and often it does come up, and people will question, is it two separate things or are they interlinked, just as you're posing in your question? I would say, is there a difference? Yes and no. If you take mental health on its own and think about that just on one side for just now, and think about, in order to have, like good mental health, you need to have protective factors in order to do that. Generally that will be good relationships, good experiences at your work, good community, all of that. But so if you have all of that in place, that's what helps largely to have good mental health. Also there are risk factors to that, so socio-economic risk factors and so on, and relationships if they're not good. And again, that would be certain circumstances that would lean on it and pull down in terms of that mental health. But moving over to the other side of well-being, if you see that as almost like a bit of a toolbox, key things in your life that you do, pleasure, closeness, achievement, value, purpose, meaning, all of those things help uphold and look after the mental health. So I think they're both very much interlinked. And certainly what we're trying to do where I work is to have that discussion as them all together, a holistic approach to that rather than it being separated.
Excellent, thank you. And maybe moving on to Tina, obviously being part of the mental health task force in the North Sea, would you be so kind to tell us a bit about what Valaris is doing and what lessons you've been communicating through your employer's experience back into the chapter?
Yeah, so I guess Valaris's journey with mental health started in 2021. The organisation was going through high change. Suddenly the pandemic hit. Like probably everybody in this room, we had offshore workers that were forced to be away from home a lot longer than was normal for their normal itch. They weren't able to communicate with their colleagues, they were in isolation in hotels, etc. And our workforce onshore were pushed into remote working. Along with the astonishing results from the ISOS survey, we did our own survey for the onshore population and realised that we needed to support those individuals that were remotely working. You know, you're going from a society where you're used to being in a group of people having conversations, and you're sitting on your own at a table in your kitchen or in an office that you've made up yourself. So we quickly realised that we need to implement something. So we started a pilot in the North Sea. We introduced mental health first aiders, onshore and offshore. So we trained our medics in mental health first aid and the rig safety advisors. And the reason we did that was because the medics are there, they have access to medications that employees that join the rig have to declare, so they're aware of people that may have mental health that they're being treated for, and the rig safety advisors are on the rig floor watching the operations, looking for changes in behaviours, etc. So we felt if we trained those as a starting point, then it would give us a good basis. Onshore we trained our HR business partners and HSE advisors. But you know, it's like anything, it's a slow burner. When you're trying to make a big change, it takes time and it takes people starting to talk about it. So in our OIM's meetings, I started to present on mental health, and again it opened up the discussion. People started sharing stories. They're not sharing their own story, as in me, Tina, you know, I've gone through a mental health issue. It's my sister, my daughter, my wife, my brother, you know, someone that they know, they recognise that they've gone through some type of mental ill health. So we started to roll out our employee assistance app because we knew that that wasn't getting the traction that it needed. There was no real uptake on it. So we made that visible. We implemented digital signage on our rigs and posted the posters with the contact details that employees could reach out to the employee assistance counsellors, etc. But one thing that we did stress to the mental health first aiders are, you're not there to counsel. You're there to provide support, you listen, and you give direction as to where our employees can find professional help. We've got all these support systems in place, so to use them. We had some relative success in the North Sea, so we implemented it in Australia. Both North Sea and Australia, mental health is talked about quite openly, so that was kind of the next easy place to start, and then we rolled it out to Brazil. But one thing I would say is one size doesn't fit all. When we rolled it out in Australia, we had to take a different tact on it. In Brazil, it was the same. You know, we had to implement mental health champions, so it was a lot softer approach, but we had 50 people train on our rigs and our onshore sites in Brazil. We're now rolling it out globally. So, and as far as the mental health charter is concerned, we've decided as an organisation that we will adopt that we're global operations. However, we'll take parts of it that fit whatever culture, whatever situation that we're in. It's our commitment, our organisation, that we're going to do, we're going to look at mental health and wellness as a focus. So.
Thank you, Tina. And it's interesting you talk about the way that there is has to be a geo-specific approach, or even maybe a rig by rig or region by rig, country by country approach to how we would tackle even just the name of mental health and well-being. And I think that's probably one of the key learnings that we heard about this morning, and it seems to be a common thread from all three of you. And maybe moving on to Mario, I understand that Shelf Drilling has recently implemented a mental health program, awareness program. And have you seen the same issues in terms of the cultural differences on a global basis, or is it being adopted in a manner where you feel that you can have a global approach?
Yeah, thank you, Doug. Actually, our experience is more or less similar to Polaris. I mean, we started more or less at the same time during COVID, because it was the time when we realized that we had to do something, because we had increasing cases where people were not showing up for crew change. And then we started to understand that many people were asking for medical leave due to mental health. So it was a time that back in 2021 when we started implementing something. And then our approach was, we started globally to implement the same kind of awareness training and assistance globally, but later we realized that as we mentioned, every country is different. But at the end of the day, I mean, all the people here are the same. So at the end of the day, regardless of which country are you working, I mean, in some country maybe like in Europe or North Sea, it's a bit easier to talk about, but it's still a kind of stigma. So it's, at the end of the day, still, a lot of people are still afraid to talk about mental health. So now this year we are taking a different approach. So we are trying to do a different type of awareness session. And the awareness we are doing this year is a bit more, we want to do something more personal. Because at the end of the day, the approach, in our view, should be on a personal side. Because at the end of the day, every person is different, but every person is kind of afraid to talk about this topic, regardless of the background or nationalities. So the awareness that we want to implement this year is a kind of open up and let them understand that if they want to talk about these issues, they can openly talk with everybody. It's not they need to go to a doctor, they don't need to go to the EAP, but it's important to talk with somebody. So this is the approach that we would like to take this year.
Excellent. Great to hear that Shell's making progress through it. And maybe moving on to Dr. Nosa, maybe sticking on that idea that Mario just finished with, that maybe the approach and discussion about well-being is widely held. We do an awful lot, I would think everyone would agree, on our installations at our rigs, talking about healthy eating, regular exercise, and maybe going back to some of the things that add more of the tools to deal with those mental health challenges. Would you agree that as an industry we have been quite supportive and adoptive of well-being initiatives, and probably lacking in the mental health initiatives?
Yeah, I mean, that's a very good point. It's very interesting, like you said, especially in the industry, well-being has always been more or less taken care of. It's very interesting, one of the findings, if you look at the survey we did, was that one of the things that helped rotational workers offshore was the accessibility to the internet. Accessibility to the internet was very key. It was one of the factors we found out. And you'll be surprised that only 70% of, for example, seafarers had access to the internet. Right? So, even when we pat ourselves on the back, we say, yes, we've done quite a bit with well-being, providing facilities, exercise facilities, internet, recreational centers, there's still a lot that needs to be done. Now, from an approach point of view, the way we see it is the approach needs to be the same. The same way we approach well-being is the same way we should approach, the same way we should approach work-related illnesses and illness and injuries, the same way we should approach mental health. So that's a lot of awareness, a lot of discussions, a lot of creating that environment where the individual will feel empowered. Now, when I ended my talk, I mentioned the ABCD. A plus C plus A plus B plus C minus D, right? So the demands, over demanding, of an employee is something that also needs to be looked at. Because the example I gave was, just for a simple work-related case investigation, made somebody break down. Why? Because every other person was more interested in the case classification rather than, sorting out what the real issue was. So the approach needs to be the same, always from a strategic point of view. It doesn't matter how much you try to empower the individual, if the environment has not been created for mental well-being to strive, then it's not going to happen. It needs to be strategic, there needs to be a budget, it needs to come from the C-suite, it needs to be budgeted, it needs to be part of the strategy, just like everything else. And I think that's probably the best approach to take. And then you just see it, and cascade down. All the studies we did were all led by the C-suite. It was even beyond the level of just the VPs. It came right from the very top, and that was why it was quite successful, in its parts.
Thank you. So maybe going to Darren, and that was a very key item that was just mentioned: executive level support. And maybe you could touch upon it. Do you see that within the NRC? Has that been maybe the key success that you have at the moment, and one of the key reasons that the mental health charter is progressing in the NRC, and is that something that we need to seek out and look for here within our region if we want to raise the awareness of mental health?
Yeah, absolutely, Doug. I think leadership, and one of the things we talked about this morning, to me, this has to be top-down driven. It needs to come from the C-suite and the executives on how we're going to handle people. That's ultimately the C-suite responsible for setting the culture within an organisation. And one thing that I see potentially happening is if as business leaders we don't take charge and push down the way on how we're going to handle this, what will happen is that employees will push up. And particularly in Western Europe, young people coming into the industry today, they're not like me, when we were young engineers, Doug, they're not interested in $1 million salary and flying all over the world. They're interested in well-being. They want to know about work-life balance. They want to know about, what are you going to do to help me feel better as an individual. And as an industry, we're not overly attractive, particularly in Western Europe. We're accused of all kinds of nasty things, and nobody wants to work for us. So you take that, and if we're not taking care of the young folk who come into our business, they just won't come into our business. So yes, absolutely, it needs to be top-down driven. We determine how this is going to play out as leaders, how we're going to look after our people, and that should bring the workforce in and certainly improve the conditions.
And maybe, Tina, maybe you can comment, you touched on it a little bit about the different geographical area reports. So if we have a top-down approach and we have buy-in for our executives and our senior management and leadership teams, but being cognizant that we need to take geographical differences and their geographical approach, how do we do that? How do we marry corporate vision of increasing awareness and putting support in there for our employees, but making sure it's approached and targeted in the right way in the different locations?
Yeah, so it's about finding those change champions. We all work in different cultures, but in every culture there's a leader, and that person can communicate effectively to a certain group of people. So it's about understanding who those change champions are, and giving them the tools to be able to communicate effectively down into those people that look up to them. And if that's done effectively, then it does work. It's been proven to work.
Excellent. And maybe Andy, you could mention, we talked about change campaigns just there, but what does role does a supervisor or an OIM have in fostering that network, that support, and making sure that his crew's mental health is being addressed? Maybe you could give us some thoughts on that?
Sure, it's pivotal. It's absolutely key. I think being in that position, you are able to pick up on the nuances. I think that Tina talked about earlier on. When you're at that level, you're able to pick up, see the slight changes, the differences, and so on. I think a key part to being supervisor manager in those roles is looking at what training is currently there and what training maybe where the gaps are and where you need to perhaps get more creative with that training. Certainly for us, we had an ambition to take through a few thousand across 2 years of a new training, mental health awareness, specifically for those roles. And I want to say we're just short of 10,000 globally now that have gone through that. It's an online. But again, as well, it's just looking at that role. We've touched on this in the panel, looking at that role and being able to get creative and find and see ways in which they're able to cascade and communicate this information out.
Excellent, thank you. You mentioned there about online training and it being a worldwide approach. Do you think that such a method of delivery has its challenges in these different geographical areas?
Of course, and I think we do need to be very careful and sensitive and considerate towards cultural nuances of all of that. But again, I think it's about being able to have key people that come along to that training. So again, it's not one size that fits all, it's training that's there. But I guess going back to the local areas, it has to be shaped in a way that's meaningful and will have purpose.
Thank you. It does seem that we need to, from what I'm hearing, we need to build a baseline of knowledge and understanding and leadership, and from there develop individual cultural rig asset, groups of people, nationalities, whatever it might be, that there's a way to affect change. With that, Dr. Nussett, is there resources readily available there, not maybe for the education of spotting issues with mental health or the support, but more of the once those mental health issues arise, we have a workforce that's deployed and we find somebody with a mental health issue. Is there support services there at the work site?
Yeah, absolutely. So one of the things we do, we have a partner called WPO, Workplace Options. They're involved in the EAP, Career Assistance Program. They're a call center of psychologists and specialists, and one of the differences with these, what we would do regularly, so take for example, you have an illness or an injury on board. When you call into our assistance center, the first person you are speaking to is an expert, a call expert that triages your case and then sends you to a doctor. But for the WPO services is totally different. The first person who picks your phone is a trained psychologist, because with mental health issues, time is of the essence. The first word will trigger the person either way, as Anne would attest to. So those services are available, and we've deployed it on a number of occasions. The case in point was one of our clients where they had a death on board. So it was a long-standing member of the crew. So we had to first of all deploy WPO services to do an online training, online consultation to everybody on board, and then we had to deploy boots on the ground because it was a security area, getting the passes done. It was quite complicated, but that's something that we do. Then also as part of that program, once you have that program, your employees have 6 sessions, free sessions as part of the package. And this covers not just them, it also covers family members. So we're not only looking at the individual employee, we're also looking at the family members. Because again, when you look at one of the major stressors for a rotational worker, we discovered that one of the most positive influence on their well-being is the proper work-life balance. a lot of people who are on rotation will go decline when family support is not there. So again, this is not just supporting the employee, but also supporting the family members, and it's all usually part of the top side support. So if you need somebody who the medic may think needs psychological support, immediately as part of that top side support, you can plug into the BPO program into it, and then the resources are there for you immediately. So not just training, but professional help and support is happening.
Yeah, Doug, sorry. I think this is one of the frustrations of the mental health scenario is that resources are available, and what we're finding in the research is that most drilling contractors have an EAP program, but I think the statistics show it's a 6% uptake because guys are just not willing to go and pick up the phone and say, I've got a problem, I've got an addiction, I'm going through a divorce. They just don't have the ability to go ahead and do that. So the systems exist, the charities exist, the knowledge exists, the solution is there. The big challenge we see, and that's why we're working as this task force, is how do we connect the employee with what's available? And that's a real challenge.
So maybe just picking up on that, you mentioned, and I heard it 3 or 4 times, EAP. Maybe someone could explain what is an employee assistance program.
I'm going to defer to HR.
So an employee assistance program really covers anything that is medical, anything that is psychological, mental. It really, has the full scope. So if you need to see a medical doctor urgently and you can't get access to your own doctors, which is quite common in the UK right now, then you could use the EAP program to actually dial and speak to a doctor in hand. Now the EAP programs are for families, and it's for everyone on the rig, not just for the employees themselves. So it's a really good resource. But one of our panelists this morning said that she didn't even know it existed until someone handed her a card, a physical card, to say, we have this, use it.
Can I just, yeah, so Employee Assistance Programme is also known as Employee Engagement Programme as well, EAPs, just as we said earlier on, jargon and language. Also as part of just the health aspect, in addition to that, some EAPs will also include financial support, legal support. Also if you're moving to a new area, relocating, childcare, schools, so it's not just at the point of health.
No, and I think it's a very interesting point, and as we said this morning, that we had a panelist who didn't even know that it existed. And it'd be really interesting to see a show of hands in the room that if in your own organisation, do you know if an employee assistance program exists? So probably just around 50%. And I think that's was one of the key things that was interesting to point out, that really what the charter was trying to do, and what I've been hearing this afternoon, is that it's mainly just a conduit to be aware and to direct people to a system of support that is already existing.
Yeah, so the charter itself is a framework. It's not policy, it's not law, it's not regulation, it's just a framework of, well, I know that at Wood Group they use it as a checklist of things. Are we doing this? And if we are we doing it the best we can? So it really is just a tool to be used. It's free of charge, you just download it. And to help drive better practice than what we've got right now. So it wouldn't specifically tell you to go at your EAP, but it might suggest that if you don't have one, you might want to look into doing that.
If I can add on the EAP, I mean, we have the same as well as everybody else, but we would love to reach the 6%. We are even lower than 6% because at the end it's a good tool from our point of view as a company, but people are not using it. And the question is, what are you not using? Yeah, most of them don't know, but even the one who know the existence of the program, they don't use just for the simple fact they are afraid to use it, they are scared, they are, again, as I mentioned before, they are maybe they don't want to talk about this issue with somebody else. Then I have a funny story that I want to share. I mean, it's a personal story because when we introduced the EAP, I want to try by myself. I want to see from a company point of view if it's going to work, right? So, and then I proposed to my wife, and then I got in trouble. So we have a 15-month-old baby. So as you know, I mean, at this age, you know, they are crying every night, and then so I'm okay because I can sleep between one cry and another, but my wife no. So I proposed to her to go to EAP. And then guess what? I was in trouble because why you want me to call a psychologist because I'm not sleeping? And then this is exactly the way how people are reacting, right? You propose something, but no, it's very important how to communicate to them, how to try to engage them to call for assistance. So I believe this is what we need to work on. We have a very good program, but I believe we need to improve our way to communicate to our employees. We need to improve the way to let them understand that calling the EAP does not mean that you have an issue. I mean, calling the EAP maybe is a good opportunity to prevent an issue today that can become a bigger issue tomorrow.
And I think that's a very fascinating discussion. And one of the things I've sat down to really think about is to try and get above that 6% is probably thinking about not just the employee himself, because what I hear is always the employee. Remember that the more important part of the employee is the family and the support group we have at home. So perhaps it's time to begin to involve the next of kin, maybe via the HR, that the next of kin themselves also understand what the programs are that are available. And I think that's a very, very important point because when they go back, they will be the ones to treat that employee. And just simple things. For example, we have, I give an example, we have a medic who is stressed on site. And then he tells us that, you probably need to prolong your rotation, something is happening. The first thing we do is we pick up the phone, is next of kin. To first of all, as an organization, discuss with the next of kin so that they know that the organization, is taking care of, that individual. Because we never know what is being communicated between your employee and his next of kin. So we need to think about it more and more from a holistic point of view than just focusing directly on your employee. And I'm sure that probably will help us to get to 10%. So just something for thought. Thank you.
Doug, if I could just add something. One of the things with offshore is that there's no safe space. So, when you're implementing mental health first aiders or mental health champions on the rigs, then you need to make sure that you have a safe space that's away from the traffic of the everyday flow of people, so that individuals can feel that they're not being watched or they're not being seen to be going into a space where, it's a mental health discussion that they're having. And that was one of the things that came out of our mental health first aider forums, was that until we have that safe space, then we're going to be challenged on being able to have those conversations.
Excellent, thank you. So many little nuances that we're able to pick up today. It's an incredibly complex topic, but I think it's something that we have to start. We started a journey on how do we protect the safety of our employees. We worked out how to improve the wellness of our employees, and I think it goes to us all. We now have to work to improve their mental health of all of our employees. And with that, I'd like to maybe, I know we've got about 10 to 15 minutes left in the session. I'd like to open it up to the audience if there's any questions for the panel. Yep. Do you want to stand up and just, hopefully we can hear you.
Hi, thanks to IADC for a fantastic session on an important topic. So in the industry, we see a lot of emphasis today on climate change and sustainability and standards being set for the companies to follow. So do you see at the backdrop of this discussion of evolution of some kind of industry standard that maybe others would really look at following, or at least work towards that direction, because I think it's an important topic and you guys have done a fantastic job in addressing it. Thank you.
Okay, I can can speak for the North Sea. What we've been trying to avoid is their task forces introduce regulation, policy or procedure at industry level, because my fear, it's a personal fear, shared by some others, is it then becomes a tick box exercise. Yeah, we comply with law, tick. We've got an EAP program, tick. Yeah, we've done mental health first aid training, tick. And I think it's too important a subject to reduce it to regulation. I think each company needs to take on the responsibility. I think we need to be really clear, it's not the burden of the employer to cure somebody's mental health issues. My view is we have a duty of care, so when they're on my work site, my duty of care is to ensure they don't get any worse. And if they are showing symptoms, then I provide assistance to help them out. But we shouldn't take on the burden of I have to fix Billy's mental health problem. That's not what we're out there to do. So I'm not necessarily in favour of setting a standard of you have to do this. I'm also not in favour of saying let's have standard training across the industry. I think there's enough resource out there from many different sources that is more than good enough. We shouldn't try and frame this. This isn't a problem like the use of PPE offshore. We have to regulate it. But that's a personal opinion. I'm not sure if anybody else wants to add on.
Just to add to that, I think one of the ways we also need to start thinking about this is a medical problem, and we should have a medical approach to solving the problem. One of the things we will discover in the industry is that a lot of our medical solutions needs to fit into the industry standards. It needs to change because we need to start thinking about things. I'm a member of the IADC Health Committee representing Vantage. And one of the things we're often thinking about is, even from a medical point of view, when we look at the ISP reporting system, it's so rigid. But when you go into a medical room, nothing is rigid. You don't come into a medical room and would say, at 100%, this is what. Yeah, thank you. And 100%, this is what is going to happen. So perhaps, we need to start looking at it from a medical point of view. What are the medical requirements, and look at how it fits. And I agree with you, Darren, because if not, it ends up being a tick-box exercise, just like what we see in many technical industries. But for the medical industry, it's never like that. Nothing is ever 100%. Nothing is ever black or white. There's so many gray areas, and decisions, are made, as you go along.
If I can add, I believe we need to change a bit of our mindset because, I thought for all our offshore drillers, we are the same. We have an issue and we want to put something in place to address the issue today because tomorrow we don't want to have the same issue. So when we talk about mental health, I believe we need to see from a different point of view because what we are going to put in place today is not going to solve the issue tomorrow. Maybe the issue is going to be solved in 20 years. Maybe we don't see the change because it's going to take time. As Darren mentioned this morning before, it's a culture change. So it's we need to start with baby steps, but no, we cannot expect that we put now a kind of framework, or a guideline today that is going to work and give us a solution straight away that tomorrow we'll have the same problem. So it's a bit, as you mentioned, it's a wide topic, so it needs to be addressed from almost a medical point of view.
Yeah, and I think as drilling contractors and a very operationally focused group of individuals, we like to fix things. We like to go in, put a piece of secondary retention on that light so it's not going to fall off tomorrow. This topic is not going to be able to be resolved in that manner. It is going to take a cultural change. It's going to take a number of iterations of what we do and learnings, and I think it's something that we just have to start on our journey. And that's really the point of this morning's session, is trying to decide here locally, how does the IADC-SAPC help and support its members starting on that journey. So there was a work group discussion this morning on what's the path, what do we do forward, what's the next steps, how can we engage, and I think this is a great initial step on that journey. Just with that, any other further questions from the audience?
Just one for the panel overall is what do you see as some of the key barriers as such to implementing a mental health awareness program within the company? So just generally for all of you, and then one for Dr. Nosa, and that is what sort of training do you give your medics on mental health awareness as well?
I'll maybe share on that. So for the mental health awareness programme, some of the barriers, brick walls that you might come up against. I think that if you take any topic, so we talked about this over lunch, most of us in the room have been along to something on fatigue management, sleep. And so if you have been to loads of those presentations, sat through lots of that content, and even perhaps if you were honest and thought it wasn't that great a session or that great a webinar, if you're framing something and naming and labelling something, I guess language right is important. So if they see that same title again, that could be one barrier, just from I've been there, done that, wasn't that great. And also, I think as well, we have to appreciate that it is how we market that, it is how we communicate that. Even just coming back to your earlier question, the first question I think it was on mental health, well-being, and I've mentioned about jargon there. Sometimes we've even had to reframe our programmes. I think I'd shared earlier on today, one of them, it was on mental health, but in order to get engagement, still the same content, obviously creative in terms of delivery, but we called it helping you to help yourself and helping you to help others, and the engagement was phenomenal. So I think a barrier, look at language, look at the way you're communicating, you're marketing, you're telling a narrative, and be open about that. And again, I think it's a lot of those barriers might be down to previous experience of that topic. And I appreciate the differences as well. Tina and I were talking about fatigue management, and seeing even if you look at the trajectory of when you maybe attended something like that 10 years ago versus today, where you look at technology, you look at the differences, the apps, the tools, resources available, it is different. So there will be something there to learn. It's just being creative, I guess, in terms of how you tell the story of it and communicate it.
And I think that's a very important point she's raised. One of the things we see is innovation. Again, it's a younger population, and how do you pass messages across? Just like TikTok videos, for example, it's what everybody's watching, and the attention span, it's reducing more and more. So you have to tailor these messages to fit what technology is making available to us. And also, awareness can never be overemphasized, right? When we look at the study again, if you look at the age group that we're talking about, offshore, the middle-aged men, it's very, very difficult for them to open up. And even within that age group, we have a high level of suicidal thoughts and rates. So it's something, the awareness piece is still the most critical piece, but how do you present that awareness campaign? I gave advice to some medics. They were trying to do some videos. I would tell them, don't make the videos long, because when it becomes too long, if it's uninteresting, people just gloss over it and it's gone. So which is a very important point. So it's, again, the use of technology. It's a new generation. What you can put on a mobile phone is going to be obsolete. It's almost as simple as that. So it's just something to think about. Okay, I take the second question. All right, so the first thing we do with our medics is to make sure that they use the EPA program. Make sure that they understand the WPO program, and we make sure that they use it as much as possible, because you cannot preach again, what you don't use. And the second thing, we're looking forward to making the mental health first aid as part of the standard training, for the medic. Currently, it's not part of the standard, and we focus more on trauma training, and medical training. But a lot more of our medics, are getting trained into the mental health and first aid program, just to be able to recognize that person they think would need help, and then advise that individual quickly to get to the WPO program, and then understanding what the WPO program offers to that individual to advise them more and more. So that's at the level we are now. Equipping them and making sure they have access to expert advice.
Excellent. If there's no more questions, I'd like to a round of applause for our panelists. We will be moving into a coffee break for 20 minutes. And lastly, we do have a small gift for each of the panelists.